YouTube world. I just realized that I haven't updated y'all in quite a while. And so, like I said before, Instagram is probably where I do the most just because I can do quick little updates, pictures, and things like that. But I didn't want to not update YouTube. So I am 3 weeks post-op from gastric sleeve surgery. My highest weight was 268.6. My surgery weight was 261, and I am currently at 240.6. So it's like 28 pounds that I've lost since my pre-op diet. So basically, that would be 5 weeks, I've lost 28 pounds. So, but since the surgery, I don't know, I can't do math right now. So anyway, but I am very, very happy with that. I'm just going to kind of walk through what the surgery was like and that kind of stuff. So the morning of my surgery, I had to be there at 5 a.m. So I got in there and I got checked in, and then they took me back and I put on a gown and they put on compression leggings. They were really hard. It was like pantyhose times 100. The nurse actually had to help me get them up because they were so tight. But once they were on, they were fine. And then they started an IV with fluids. And the anesthesiologist came in and talked to me and asked me if I had had issues with anesthesia in the past. And I said I usually throw up. And so they put an anti-nausea patch behind my ear. And they said they would also give me IV medication for nausea. And then my surgeon came in and just said, "Hey, you ready to go?" And I said yes, and we talked for a few minutes, and then I was on my way, and we walked straight to the surgery room, and they laid me down, and I don't remember what they said exactly, but I mean, within 2 minutes, the mask was on my face and I was going to sleep. I remember waking up and hearing them talk to me like, "Okay, Cassie, we're moving you to your room." I'm like, "Okay." And then they were like, "Does anything hurt?" Pain. Because like my throat, it was so dry and I was so groggy that I was just like one word, thirsty, pain. And so I remember trying to force myself to wake up because like my eyes were so heavy, and the nurse came in, she's like, "You don't have to like get up, you're fine if you just want to sleep." But I'm like, I wanted to get up to see how I felt. So it took me probably a good like 5-10 minutes of like forcing my eyes to stay open and look around the room and everything. And I will say I wasn't in like excruciating pain. I was uncomfortable, but I wasn't like so bad in pain that I needed something, immediately. And I remember saying, "I'm so thirsty," but they brought me ice chips because they didn't want you drinking yet. So they brought me ice chips, and I just kept sucking on those because seriously, mouth, the driest it's ever been in my life. I mean, it was like hard. I couldn't even talk after a few minutes. I couldn't make words. Nothing was coming out. So I was like, those ice chips were coming constantly. And of course they were coming in and taking my vitals and doing all those types of things. And then when I did start to get uncomfortable, I just hit my nurse's button and they brought me pain medication. They did IV medication. They did morphine for like the first couple of hours. Then they went to tramadol. Is that right? I think that's the right name. And I was on that for like another 12 hours or so. And then they switched over to oral pills. And I was also given a sippy cup with regular Powerade in it. Whoa, sorry, the lights in the parking lot just came on. Anyway, so yeah, so I was given a sippy cup with Powerade, and I was just sipping that like every few minutes. I was taking a sip. It hurt. I don't know if it just felt really weird going down into my chest. So I probably wasn't drinking as often as I should, but that's completely normal. Like, it's just, they just did a whole bunch of stuff there. So of course it's not going to feel completely normal having fluid go down. So, and then if I remember right, because my surgery was at 7:15 at night, because I did an Instagram video, I still was just ice chips and Powerade. I think my first meal was breakfast the next morning, and I had an option of like cottage cheese, yogurt, cream of wheat, and I don't remember what else. There was several other things. I chose cottage cheese. And I ate maybe like 2 bites of that. And I was like, okay, I'm done. I can't eat anymore. And my stomach and throat were all making noises and stuff. It was very weird. But I got up and go to the bathroom. They, of course, want you up walking a lot. They had these things on my legs that would like squeeze to prevent blood clots. So I had like an IV. I had another IV because they added another one while I was in surgery. So I had 2 IVs. I had this monitor, these stick things all over me, a little power pack in my gown. Then I had my binder wrap around my abdominal. I can't talk. Then I had the compression things and their things on my, so I was like, oh, and my blood pressure cuff. So I was like full of stuff. And so when I would have to go to the bathroom, they'd have to come in. Oh, I had oxygen too. So they had to take my oxygen out. They would have to take my blood pressure cuff off. They'd have to take off my little things that were squeezing my legs. I can't remember the name of them right now. And then I'd get up, walk my IV stand to the bathroom. And I had to do that every time I went to go walk laps too. So it was kind of like, and I was sleeping okay, but I was looking forward to being back home. So after a full, I want to say like, let's see, I went in on a Thursday. I think I came home Friday. Yeah, I came home Friday night. So Friday the surgeon comes in and says, how you feeling? My stomach was making all the noises it was supposed to be. I had passed gas because that's one of the requirements. You have to pass gas before you can leave. So I had passed gas. I had done all the things. And so he's like, all right, you can go home. So they came in, undid everything, gave me my prescriptions that I was going to be taking once I got home. And my husband came and got me, and I went home. And since then, the first week was rough. More sleeping. Like, I couldn't get comfortable. I wound up sleeping in the recliner for like the first week. I started off in my bed, but because I'm a stomach sleeper, I could not get comfortable. And so I went down and then I finished in the recliner. The second week I was able to stay in my bed. But like I had to like hold my belly as I was switching from left to right, just because it was uncomfortable. But now this past week, I'm like almost back to completely normal. Like I slept on my stomach last night for like a little bit. So, the pain by far is way better. In fact, I don't really have pain except for the one incision where they put the biggest instrument in and they pull your stomach out through that part. That's the only one that still gives me any kind of pain or pull. My kids are still really careful that they don't like bump into me on my stomach and things like that. The biggest hurdles right now, which you will hear from anyone who's had weight loss surgery, is getting protein in. It's absolutely so hard to get protein in because you fill up super fast. Your taste has changed. So like I loved chocolate Premier proteins and they're still okay, but like I used to be able to like just, chug one. Well, you can't do that. So I'm sipping on it and I don't know if it's like the ingredients in there, but like my tummy gets a little upset from them. So, and you're not eating enough, you can't eat enough protein. So you have to do protein supplements. So actually I just ordered from Target this Isopure Taste Infusion or something lemonade that someone on Facebook said they use. It's 20 grams of protein per scoop. And so, and then she said she just uses like some Crystal Light drops to like add more lemony flavor to it. So I'm very much looking forward to getting that and using that to try and get my protein up because I know I'm going to have hair loss issues. I know it because it's been 3 weeks and I've not gotten my protein in. So I have to realize that that's going to happen in a couple months. I'm going to lose some hair. So I really want to get my protein up to minimize that as much as possible. And then I'm tired. I'm serious, guys. Like I go to the store, pick up groceries nonetheless, carry them in, and I'm like, I need a nap. So I'm sure a huge part of that is not getting enough protein in. I've read a lot that once people were able to get the right amount of protein in and the right amount of fluids, that their energy level increased. I've also seen that it takes a good 6 to 8 weeks for complete healing to where your energy will improve. So I'm only at week 3, so I'm taking it easy. My husband is being amazing. He did so much of the housework, and even now, like, he's like, if you are too tired, I will take care of it. And I'm like, bless you. My husband bought me a treadmill for Christmas, so I'm trying to get on that. They want 30 minutes a day. Sometimes I can only do 20 before I just can tell I just need to sit down and just rest for a little bit. But I know that's going to get better. So I think I covered everything. So overall, guys, I'm doing really well. I am, one more thing. I want food. Okay, you'll hear about head hunger. It's real. It's very, very real. I drive by McDonald's. I want a freaking burger. I want tacos. I want those things. But on the flip side of it, what I've been telling myself is, you have a year, Cassie, to get this weight off of you. Then you're going to be able to eat more types of food, and you can go and make healthier versions of what you like. I did keto for like 6 months or 8 months trying to lose weight, and I loved keto. It just I wasn't losing weight on it. And so this time I'm going to do a version of keto once I'm on general diet. But I'm going to really watch the fat intake, just because they said after weight loss surgery, you really need to focus more on the protein first and then add the other things. But I just keep looking for, like, this isn't forever. I'm not going to be able to just eat 3 bites of food and then be full. And if you have had weight loss surgery, you know this is true. If you are thinking about weight loss surgery, you'll know you're full because you'll start burping and your chest will start to feel funky. You're just like, your body's saying, nope, no more. And sometimes that's after 3 or 4 bites of cottage cheese. Sometimes that's after like a half a cup of yogurt. Like, it very much varies day to day what my body can handle and what it can't. So I'm still on pureed foods for 1 more week. Then I go to soft foods. So I will try to do another update here in a couple weeks, just to kind of update as the diet changes, or if I think of something else that I forgot to include in this video. Also, if you have questions, please post them in the comments and I will gladly respond with a video. Thank you guys for being faithful followers and following me all the way back from 2017 when I started trying to lose weight in general. I'm thrilled that it's coming off finally, and it's going to come off and it's going to stay off. So I just want to say thank you. I hope everybody's doing great, and I will update soon. Bye.